let's get back to your business resiliency webinar and talk about some of your main points. You know, if you had to think about maybe your top 2 or 3 or 4 main points for dentist practice owners to really consider right now, you know, what would those be?
So I alluded earlier to about the financial checkpoint. I think you need to really get that assessment. And that's first and foremost, because I think once you have that shored up and you have a better idea of what you want to do or need to do, that's going to be better for you in the long run, period. That takes a lot of the pressure, the steam
Yeah.
off. Secondly, I think you need to really have a plan and be a true leader for your team, because I think right now your team is going to look to you to obviously give them a lot of information. I think education obviously is very powerful, but they've got to believe in you, and you need to be their pinpoint for all of that education and really step up and be a true leader. So you've
Yeah.
got to get very knowledgeable about this novel virus, because it's we were hearing initially 14 days in the transmission window, and now that could be 21 days. Does it stick on cardboard? Are you spraying your boxes with Lysol? I mean, all of these really crazy random things we've never thought about now enter the equation. I think with our team members, again, through our patient communication system, I'm able to have a private chat room. We talk, we encourage each other. We're still doing very important things that really keep us connected. We're doing a lot of things in the background. I don't care if it's insurance processing, shoring up protocols or systems. We're making sure everything's tightened up and revamping a little bit, even refreshing your website. I talked to a colleague last week who's even painting a couple of ops, and within his practice. I mean, whatever it takes, you're doing those things. But
Yeah.
the team, I think you really have to shore up. That's the other leg of that stool. And the third leg of that stool, I think, are your patients, where we can create like little fun videos that we're showing them to start having that ground lane work of saying conversationally, hey, we're going to be safe. We're going to take good care of you when you come back. We're going to be ready to be your dentist again, and keep them within that family and that conversation, because they do trust us, and we are family and extension of family to them in many ways.
Yeah, excellent. I mean, just amazing advice. One thing you said made me think of another question, which is when it comes to education or resources right now, is there something special you're doing, places you're going to find great education or resources?
Yeah, so there's some really good programs out there. Dental Town actually last week had some really good experts on
Hmm.
that really talked
Saw that. That was excellent.
length, yeah, of just really just everything from manufacturing to just day-to-day process and practice. Dr. Gordon Christensen was on, as well as Rella Christensen. So wonderful advice there from them. I think Viva Learning has some really good programs right now on
I
with
agree.
Dr. John Molinari. He's done some things there that really practical, good, sensible things we can take away. Hugh Freedy has a really good one, the Green Light, right now you can go on, again, with infection control.
Hmm.
Companies like Zerk, who have really amazing organizational things, are actually coming in and doing like a virtual organizational tasking within your practice. So you can open up your cabinets and you can virtually go through, and they can help you reorganize things. So to me,
Great.
these are times to take advantage of that and really make that happen.
Yeah, you know, it's so great. You know, I think a lot of companies are trying to do that. Hence, part of our call today. You know, I'm trying from your
Absolutely.
standpoint, we want to trying to reach out to as many colleagues and professionals and kind of find out what they're going through to kind of keep that discussion going, as you mentioned. One other really cool thing that you said earlier that I wanted to kind of bring back up, and then we can wrap it up. Was you'd mentioned about hydrogen peroxide, and that knowing that hydrogen peroxide has been shown to kill the virus, whereas the other common rinse that we use in dentistry, chlorhexidine, has not. And so, you know, maybe we're all looking at the same resources, but regardless, it's wonderful to hear that that kind of message is getting out, because we're so used to using chlorhexidine, not so much on the hydrogen peroxide side.